Hi everyone, Dr. Chelsea here with Treasure Valley Pelvic Health, and today I'm going to highlight the key tips and strategies I routinely give people to help eliminate their bladder urgency, frequency, and incontinence or leakage. So keep watching to learn my hottest tips. If this is your first time joining me, I am a pelvic health expert and energy medicine practitioner. Now, oftentimes people come into the clinic and are telling me about all of these frustrating symptoms, but they always put it in the caveat of, well, that's just normal or to be expected, especially after having kids. However, I'm here to tell you any sort of loss of bladder control or urgency or frequency is not normal. It is very common. In fact, 1 in 3 women experience problems with their bladder control. However, it is not something that they have to just live with. There are many things and many strategies that you can do to help eliminate those problems. First of all, it's important to understand and recognize that it is still important to have a consultation with a provider who can do a full workup and a full assessment to determine what exactly is really going on. If there's no other underlying issues, then oftentimes seeing a pelvic health expert can very smoothly and seamlessly and effortlessly eliminate any sort of long-term problems. Now, first of all, what I hear is people say that they have a small bladder, so they just have to go more frequently. However, this is most often not the case. More often than not, what has happened is that the communication signal between the bladder and the brain are not in sync and a little bit imbalanced. So when the bladder stretches, that first time it starts to fill up, the brain, it should interpret it as just a tap on the shoulder, just a little heads up saying that things are starting to accumulate. We might need to find a restroom in the semi-near future. But for many people with this problem, what is actually being registered in the brain is more of a 4-alarm fire saying, I gotta go now, move it or lose it. So we gotta work to retrain the brain to interpret the signal from the bladder more appropriately so that it doesn't think it's an emergency when it's really not. So how do we manage the urge? First, we have to really get control of the urges so that we can get the brain and the bladder to get back in line with each other. So when you do have an urge, I know this sounds counterintuitive, but I want you to sit down instead of rushing to the restroom. Oftentimes I find people will get in more trouble and have leakage happen more frequently when they're rushing to the restroom because they can't control the muscles as easily than if they were to sit down, regain control of the bladder, and then head to the restroom. So first of all, I want you to sit down. Now, sometimes if it's a really strong urge and you just don't think you can hold it, I'll encourage that you put your hands to your perineum, kind of like a little kid when they've got to go potty and they're doing a little potty dance, right? So put that to the perineum or where you urinate from, and then you can regain control and eliminate that urge maybe a little bit easier with that sense of providing a little bit of security by that extra overpressure on the external area. Then while you're sitting there, I want you to do some Kegels. Kegels help relax the muscle of the bladder so that you can eliminate or decrease that urgency and be able to move without feeling like you're leaving a trail. The more challenging piece is trying to not think about it. Now, if you think about having to use a restroom, then you can oftentimes make yourself feel like you have to go. And that is where if we can turn our attention away from that, then we're gonna have more success at being able to manage those urges appropriately. So if you're in a bind and you're sitting there trying to eliminate the urge, I encourage you to count backwards from 100 by 7. That's usually enough painful math for people to be able to forget about needing to use the bathroom and work on the math piece itself. Now, once you get the rhythm of counting backward from 100 by 7, start with a random number and do the same. 7 is a more challenging number for most people to do subtraction from, so then they're going to pay attention to that. You can read a book, you can recite scripture, sing a song, recite your to-do list, anything else but thinking about what your bladder is doing. All of this while you are doing a Kegel and trying to suppress the urge. After a short period, you should be able to move without feeling like you're going to wet yourself or that strong urgency subsides. So I encourage that you assess yourself and see, do you have that pressure sensation like you have to empty your bladder? Or can you continue on with what you were doing? Ideally, you should be able to suppress that urge another 15 to 20 minutes, usually is when that second urge will come back. And at that time, if you're just beginning, maybe go ahead and use the restroom then. If you feel like you can wait a little bit longer, then try and suppress that urge again. Now, following this discussion, I often get the question of, well, then how do I know when I should go or if I've waited long enough? So the easiest method that I have found is to encourage people to count how many seconds it takes for you to empty your bladder. In general, with a slow, steady second count, it should take at least 10 seconds or more for a true adequate urge to fully empty from the bladder. Also, void should be no sooner than 2 hours from that last void or no longer than 4 hours apart. If you are going sooner than 2 hours, then I want you to really try and use this strategy and be able to space that out a little bit longer. Or if you are waiting a little bit too long, then I want you to check how much water you're drinking. Now, something I routinely hear again is women saying they will go just in case so they don't find themselves in a bind and end up having any sort of leakage or in a stressful situation. Doing this sort of practice actually creates more imbalance in that communication between the brain and the bladder. So I really recommend only using the restroom when you truly have an urge. Use the strategies we talked about previously to help minimize the urgency behind it. And then once you can move without feeling like you're gonna wet your pants or that strong urgency, then head to the restroom if you really feel like you have to use the bathroom. Now, when talking about the bladder, it's important to discuss hydration. This can be an interesting conversation with patients because it can often be a pain point and something that they limit in order to try and control their leakage or their frequency. However, it's counterintuitive to think that just by increasing your water volume that you're going to improve your bladder function and control. The reason being is that as we are dehydrated, the urine is more acidic and becomes more irritating to the lining of the bladder. So then the bladder wants to expel it and will kind of create that sense of urgency a little bit stronger. So we have to stay hydrated. So wherever you are at in your drinking journey, I encourage adding at least 8 ounces a day extra to wherever you're at. Some people, if they're doing really poorly, maybe 20 ounces or less. Okay, let's start with adding 8 ounces for that first week, and then another 8 ounces the second week, and progressively your bladder will adapt to that extra volume. If we go from 20 ounces to 60 ounces, that's more than double than what it's been having to manage previously, and it can increase your urgency and frequency in that case. But if you do it slow and steady, then it becomes a little less daunting. The other thing to consider is that if you are drinking larger volumes of water or trying to get your water in by the end of your day, you have to be careful that you don't drink too large a volume at one time. Think about it as a sponge. If you were to take a cup of water and pour it over a dry sponge slowly, it has more time to absorb and be used in the sponge, just as it would have more time to be absorbed into the body. Versus if you just dump it on the sponge, it's going to go everywhere and some of it will be absorbed, but not as much. So if we chug a large volume at one time, our body is overwhelmed and it just processes it super quickly because it doesn't have enough capacity to be able to adequately use it. So my key tip there is to sip on water frequently through your day instead of really trying to get just the total volume. Yes, the volume is important, but shoot for maybe 8 to 12 ounces in an hour, sipping on it throughout that hour instead of chugging it all at one time. Now, some people will ask about bladder irritants, and this can be true for some people, but not as many, again, as what people think of. Bladder irritants can really vary and be specific person to person, though there are some commonalities for many people, such as coffee, alcohol, caffeine, even acidic fruits or juice. So be careful. Now, if you're really trying to pin down what your irritant is to your bladder, I encourage that you do a bladder log where you list out everything that you eat and drink in a 24-hour period, and then indicate the sense of urgency behind each void and whether or not you had some leakage. You can usually start to pin down over the course of a week or two of what your exact irritants are for your bladder. Now, it's important to talk about Kegels and what exactly they are and their function in the bladder area when we're talking about bladder function. So a Kegel is simply a contraction of the pelvic floor muscles. However, the most important thing that I find routinely talking to women about is what a true Kegel feels like and if they're doing it properly. There's so much information out there as to what a Kegel should feel like, but it kind of varies depending on what your target is. If we're trying to control the bladder, then we want to be able to feel contraction a little bit more to the front of the pelvis. If we're trying to control more in the back towards the rectum, then we want to make sure that we're feeling the contraction there. Or sometimes we want to make sure we're getting both front to back. Now, it's also important to recognize whether or not a Kegel is something that you should be doing. It isn't the end-all be-all solution for bladder control. Sometimes the muscles might already be too tight so that if you're trying to control leakage or urgency and they're already tight and they just can't contract any further. So we have to be able to assess whether the muscles are able to fully contract as well as fully relax sufficiently in order to really optimize the control of the bladder. Now, another angle to consider is the mobility of the bladder and other associated organs. This can be assessed by somebody who has been extensively trained in visceral manipulation or the mobility of the abdominal and pelvic organs. There's so much interrelation and interconnected pieces to each of the organs that it has to be assessed. If the bladder isn't allowed to move and slide and glide sufficiently, then when it tries to fill up, it's not allowed to expand. So then in turn, you're going to have premature sense of urgency. So it's important to have someone, again, who is extensively trained in that visceral manipulation technique. There you have it, folks. Those are my key strategies and tips in order to help people improve their bladder control and eliminate any of these frustrating symptoms. So if you found this information helpful, click subscribe and comment below and let me know what you found most helpful or if you have any additional questions.